Thanks for staying with us. We just heard from Prince Tega explain to us exactly what happened to his wife. It's a very emotional situation, and nobody wants to be in this kind of situation. One of the things you said earlier was the fact that your wife lacked adequate monitoring, and the consultant was not around. He came in for 10 minutes and he left, and obviously he was being distracted because he had to be elsewhere. I saw one of in the comments here from the reports that we got, saying that the hospital claims that they are not negligence in any way, that they kept a midwife and a medical officer in the facility, that the O&G surgeon was stuck in traffic. The incident was therefore reported to the HEFEMA, awaiting a response.
So if you were not a medical personnel, we probably would not know this much information, because the challenge is you, being a medical personnel, understood what was expected to have been done at every point in time. That wasn't done. So you mentioned the lack of, she wasn't intubated in time.
Exactly.
There wasn't an anesthetist
or an intensivist.
An intensivist at the time.
No pediatrician.
No pediatrician to help, and somebody, a pregnant woman in labor, and they already knew there was complication because it was a delayed labor that was being induced. There should have been a pediatrician on ground. And I know that many times when we talk about these things on the show, or it goes viral on social media, people feel bad and there's and then we expect people should just move on. But if we move on, another person another person will become a victim. What would you like to be done in this case? Mariah asked that question because she asked you what was wrong. I'm asking, how would justice be served for you?
Oh, so for me, justice will mean, because my biggest fear is someone else's daughter or someone else's wife, because the pain I felt, the agony. Imagine she died leaving a 4-year-old child. She's motherless. My son was denied the right to live. She was sent to the grave. How old? She was just barely in her 30s, in her prime of life. So I want justice. Justice will mean that the hospital should be shut down. First. The hospital should be shut down. That's not a place that people should go and take delivery. How can you are organizing a labor, obstetric care? The only person authorized for surgery is another branch. Is that not a disaster in Loom? That's already, you're already asking for trouble. So I want justice. Justice in this case. And the hospital feel I'm a nobody. They feel they can just buy anything or buy anybody. So I'm constantly being intimidated. And as we speak, my baby's placenta is still with them. My wife's uterus is still with them. At the police station, they said they handed over to me. How? Where is the document? You gave me death certificate for my wife's corpse. You gave me death certificate for my baby. But the uterus and the placenta, you didn't give that to me. Why would I come and be lying? I won't do that now. So those things are still with them. Why are they holding on to it? Is it that they don't want the autopsy they want the autopsy to be inconclusive? Because without the uterus, obviously the pathologist will struggle.
When did this happen?
On the 8th of March.
8th of March?
Yes, wow. 2024.
It's a month,
so
almost
far.
2 months.
Yeah. See, this is a very difficult situation because we're going to try to see if we can get the hospital to also comment, because always in media you have to get all parties. I know that our producer have tried to reach out to them to see if we can get their comments, and I know that we're working to hear their own side of the story, because in every situation like this we have to hear all sides. But it was important to hear yours first, to know exactly what happened. As a nurse, do you personally have any regret? What do you think you could have done better? Maybe the moment the consultant said, I can't see you till midnight, you could have taken her to a different hospital, or maybe changed somewhere, say, you know what, this is already a red flag, I'm going elsewhere. You did at that time, didn't think there was any need for alarm?
I think my greatest regret is staying. When he mentioned he wants to induce in the night, I would have just left. So I thought, no, he gave me assurance.
Yeah.
All the
that
records are
yes,
there.
yes, it gave me assurance.
Hospitals they don't like taking pregnant women, because I had that issue. If you go to another hospital at the point of delivery,
Yes,
they will
you will
say,
come in as on book.
Yes.
And it will be a difficult record for them. So this was the same hospital that told us she was pregnant. That she did all her antenatals there.
So you trusted that?
Yeah, we trusted, and they assured us that the delivery would be safe. So what happened?
Was your first child born there?
No. My first child was born in another hospital. And they skillfully did it. She was induced. So how come she's dying this way? Even my pain is, why did they neglect her for? Why was there no a surgeon?
Have you spoken to the consultant since this thing happened? What did he say?
Okay, when I spoke to him, he said the plan was to rush down. I was like, why will you plan to rush down? That everything happened so fast. That the doctors kept telling him that, that she was not contracted. So is that not enough to come and see this patient yourself and assess the situation? Okay, the first misoprostol failed. The second one failed. Those are indications for surgery. Failed induction is an indication for surgery. Why go ahead with the second induction? That's what busted the uterus. She was bleeding massively. They didn't know. They had to wait for her to be unconscious. So what's the difference between the team and people selling pepper in the market? If they have to wait for a woman to be unconscious before they knew that something was wrong.
I have questions that you cannot answer. I have questions for like the Commissioner for Health, the board that certifies hospitals, that can in place, how many personnel should be on ground for a hospital to be running?
Exactly.
Who are the technical people to be on ground for delivery to take place?
That question is so important, because you will have a hospital, you will call it a hospital, you have 2 nurses and 1
junior doctor.
Junior doctor.
Without experience.
And you say it's a hospital. That is not a hospital, that is a clinic, and it's a clinic that cannot
handle emergency.
Yes, handle emergency.
So,
but this hospital we're talking about is a big hospital.
Yes.
So they should.
But they didn't have. So that's what I'm saying. If the Commissioner for Health or whoever is managing the hospital, the regulatory board can say, FEMA can say, okay, every hospital that is handling delivery must be able to handle A, B, C, D. And the moment this happens, this is the next process. Because when we don't have these things, a patient should not have to worry their head about, I'm not a doctor, I'm not a nurse. I have come here to trust that I am in the hands of professionals, that they know what to do.
So FEMA has been notified? And
yes, we've written a petition to FEMA. Okay. So they are investigating. So they promise to ensure that justice is served. But I'm just hoping that they don't compromise.
Yes.
I'm just hoping. We also wrote to the Commissioner of Health and the Permanent Secretary, also hoping that they would, but I need help. Me against them, I'm scared that justice might be swept into the carpets.
Okay. So that's one of the reasons why we're giving you our platform to share your own story. We know that investigation is ongoing, and we also probably like to hear from the hospital themselves, but the truth is, justice must be served either way. And once again, our heart goes out to your family, yourself. I mean, this is a very difficult situation. I know Nima wanted to question. Yeah. So thank you very much, sir, for sharing your story with us.
Okay.
And we'll have to, I think I have a caller, I believe. Let me see if I have a caller. Good morning, Ola. Ola for God. You're live. Go ahead, please.
Can I talk? Can I speak?
You're live.
Good morning, ladies. Can you hear me, please?
Very clearly. Go ahead, please.
Yes, good morning. My name is Ola Daniel Rumke, and I'm a first caller.
Welcome to the show.
Thank you very much. I'd like to contribute to what is happening. I'm a mother, and I've gone through this kind of situation. Honestly, in Nigeria, we need to have respect for life. And we need to know that every human being is equal before God. I look at that young boy, that young man, and I've been tearing, honestly, watching your wife dying and something you can't. I really want justice for this man. I really want justice. This same thing that happened to him happened to me. I lost 5 babies before I had the first one. And a registered hospital that my bank uses. They need to go and comb all these hospitals. If we have clinics, let's know that we have clinics. If it's hospital, let's know that it's hospital. We women that are going to labor room, we are sitting on the fence, either to jump to that side or come back. There should be respect for life in this country. At least out. Let us have fairness in judgment, please. I want justice for this man. Otherwise,
thank you very much, Ola. And that's one of the reasons why we're giving the platform. Any comments?
Nigeria has the 4th highest mortality, maternal mortality rate in the world.
Yeah.
Nigeria
about 23% of the global deaths.
Compared, and they are comparing Nigeria with South Sudan, Chad. These are countries where, in terms of the facilities and resources we have, is very far apart. So when we're talking about this as women, it goes beyond. It's not just our heart goes out to you, but we know that we could easily have been your wife. Right. We could easily have been your wife. I could easily have been your wife. I had a D&C done when I had a miscarriage, and they did not take out everything completely, and I was bleeding for weeks until they had to do another one again. So this medical negligence and things must be. People need to speak up, and I'm happy you're fighting this. And whichever way, I think all the civil society people should support you in fighting this to ensure justice is done, that this is not just going to be one of the other statistics that will just be gone like that, that we would ensure that this would be a landmark that would ensure other women that go to hospitals are treated better, and it doesn't become a life and death situation because you have gone into labor.
Did you speak to the medical director of this hospital, the head of the hospital? You got a chance to talk to him?
Yes. At a meeting we had, they told me that they were not negligent. In fact, they kept one was asking me, what's my concern with the consultant? Do I have a personal issue with him? After all, they kept a midwife and a doctor there. Why am I accusing them that they were negligent? Were people not there? I was shocked. So my wife was just helpless. Nobody to do surgery. A complication that you caused. This is a complication that you caused.
Could a midwife do surgery?
Okay, no. Let me take Salisu from Jos. Good morning, Salisu. Thanks for calling. You're live.
Hello, good morning.
Good morning.
Good morning. My name is Salisu calling from Jos.
Yes, go ahead.
My deepest condolence to the young man over his loss. Please and please, Morayo and the team, this is time for you to help. I like the way you said you are calling them to hear their own side. But like he admitted, they are too powerful for him. We all, from our own end, will be praying for him for justice, and you also have to help him. Nima, thank God she is in the legal field. Please, do whatever it takes to provide him the legal services needed. And Madam Tope was saying that 4 years back there was something similar. And as God will have it, God made it that it happened to somebody that has medical knowledge. Because it happened to him, that is why you are hearing all the other angle of this story. Please, these people are powerful. You have to help him. I know what you people can do. Your team is one of the strongest force I know, and you are out for justice. Help this man. We are praying for him. This thing should not be allowed to just go like that. Thank you very much. Thank you.
Thank you very much, Salisu. I mean, one of the reasons why Nima is emotional, because many of us know her story, how difficult her last pregnancy was, and everybody understands. Many of her viewers and followers followed her story, so she understands exactly what she went through, and that's probably why it's difficult for her to speak. But the truth is that nobody wants to relive that experience, especially when you remember the hospital, the going back and forth of doctors and nurses, and the people looking confused. That scenario is the worst thing any woman wants to be in a situation where everybody around, they don't know what, they're confused. So I would definitely like to hear from the hospital. I mean, although you already told me their own point, say that they're not negligent. But the truth is that something went wrong. And that thing that went wrong, somebody must be responsible. Somebody must be held responsible for the negligence on the part of the hospital or whoever is at fault. Let's take a few comments before we now wrap up on this segment. Any comments on social media?
All right. So they said... they are mentioning the name. The Nigerian health sector has a long way to go. Onoche says, waste of time. Nothing will happen. Nobody will do anything. Another person said, the sad thing is this will not be the first, and it might definitely not be the last. Nigeria has zero value for life. That's from Shayo Adeyeye.
I would like you to...
Go ahead, Ricky.
Defend yourself here. Charity James says, This is very painful, but Nurse Prince, you acted very slowly. But for a trained nurse and a very experienced nurse, we are trained to be very proactive, especially when you know things, how things work. I would like you, she is saying you acted slowly. From your story, I don't think so, but I'm not a trained nurse. She apparently is a trained nurse.
And you can't really, when they gave me 100% assurance that she will deliver safely, that was at least enough to stay now.
And was the wife's preferred hospital?
Yes, and it was my wife's preferred hospital.
I also feel like
and she
treats their patients because
yeah,
sometimes emotional attachment might.
And she's very close, and the branch is close to our house, so she was enjoying that proximity to. But they are just full of lies. Tomorrow they will come here and say, oh, they didn't transfuse. Okay, if you knew that it's a patient that you could not transfuse, why didn't you refer?
Exactly.
Not referring means you could handle the care.
Okay, I think, is this Grandma Wumi? Good morning, Grandma.
Good morning.
Yes, very well. Go ahead, please.
This is really, really pathetic. And I commiserate with this young man. So even, and I have to commend him for coming to tell Nigerians what really happened. It takes a lot of courage. I think Nigerians should know how to cherish their citizens. Moreover, last week I was watching your program. I saw a nurse taking pictures while a lady was in labor. Who are these nurses? Who trained them? Where are they coming from? I want more number to share things for goodness sake. I hope this mass incident will do something in Nigeria as a whole, not only in Lagos State, in Nigeria as a whole. And Thank you, Mariah.
Thank you very much, Grandma. Any comments? Okay, we're going to wrap up on this right now, but as I said, we have to just wish you the best, and we'll see what to ensure that you get justice that you deserve. And hopefully we'll follow up with FEMA to be sure, and let us know what's going on. Keep us posted, and we'll be happy to support you in any way.
All right, thank you.
That is all we can take on this segment. When we come back, move on to our final segment. Stay with us, we'll be right back.
Stay tuned. Your View will be right back.